Yes, sir.
Okay, this is the note you're filling out, not Nurse Brown, right?
Correct.
Okay, entries that you're making into the system, correct?
Correct.
And these are entries also, doctor, that you signed off on, aren't they?
Yes, sir.
Okay, and when I say signed off on, that means that you have electronically signed this chart, correct?
Correct.
And what you're representing to the public and to the hospital is the events reflected in your chart are accurate, correct?
Check to the form. You can answer.
They are as accurate as I could kind of put together after the emergency was over.
Okay, because if there's an inaccuracy, you can always come back after the fact and make changes, can't you?
Check to the form.
You can.
All right, so let's go to the bottom of page 11, next to the 1650 note. Under procedures, do you see at the bottom?
Yes, sir.
When did you write that compression started?
I wrote the same time as Cindy Brown, because we had kind of talked about it, and without looking back at the strips, we just kind of guesstimated.
The point is, you're representing to the hospital and to the public, even as of today, chest compressions on Roy King started at 1701, didn't you?
Check to the form. No public is reading these records.
We are. When I say the public, I mean us. Didn't you, doctor?
Check to the form. Same rejection.
I did, let's see. Yeah, I mean, I wrote that because I was trying to reconstruct the time without actually going back and looking at the times. At the time, we were trying to get him transferred to Park West and get a as complete chart as we can, so they know what medications were given, and so the times didn't seem to affect what was going to happen when we got during the transfer and the transfer. So we weren't very specific with those.
Two places in the chart where both you and Nurse Brown have recorded the chest compression started, correct?
Correct.
Okay. Why don't you go to page 8. Once you go to the top where it says 1819 with Nurse Brown, it
Yes,
says patient left the emergency department. Is that time correct?
let's see. I would assume, yeah, I would think that would be correct, because that was after the patient had been stabilized. So we could actually chart while we're in real time, instead of having to go back and try to compile which time was when.
Why don't we stop here for a moment and let's walk through what happened, okay? What were you doing at the time that Mr. King, I see from your assessment, you saw Mr. King when he came into the hospital pretty quickly, didn't you?
Yes, sir.
And you did your assessment,
Yes, sir.
and you ran EKGs,
Yes, sir.
and you called a hospital to see if he could get transferred, correct?
Yes, sir.
All right. At the time that you saw him, did you know that he was a smoker?
Yes, sir.
Did you know that he had prior history of coronary artery disease?
Yes, sir.
Did you believe that he was at risk of having a heart attack?
Yes, sir.
All right. And I can read your chart and see what you did for him, but eventually, was he moved into ER room 4?
Check to the form.
As far as I recall, he was in ER4. Yeah.
Okay. The chart says he was moved into ER4. Do you know why it would say that?
No, sir.
Okay, so he stayed in the same room the entire time he was there, correct?
Yes, sir.
After you did your assessment right before the code, where were you?
After I did my assessment before the code, right after the assessment, looking at the EKG, it was didn't show any acute changes, but I was still pretty concerned because of his history. So I called Lifestar and called the transfer center because UT is typically the fastest transfer we can do, and relayed my concerns to the transfer center. Faxed the EKG so there was that, and yeah, I talked directly to the transfer center, and then carried the phone around. So when they called back, I would have be able to talk to them again. So I talked to the transfer center right after seeing him.
Appreciate that, but that's not my question.
Oh, sorry.
Where were you when Mr. King coded?
Oh, when he coded, I can't remember specifically if I was. I would have either been directly, maybe 7 or 8 feet across the hall there at the nurses' station. I could have been in another room. Yeah, I don't recall.
Were there other patients in the hospital at the time?
Again, I just don't remember.
How would I find that out? Who would I ask?
I would think it would be pretty straightforward with just the medical records, I would think, or I'm not sure exactly.
Is there a sign-in sheet there where you can see when patients come in and when they go out?
There's not a sign-in sheet, but it is electronically kept, so it should be there. Yeah.
Fair to say that at the time Mr. King coded, you weren't providing